Endoscopy Access Lean Project. Occasionally, significant changes to processes and procedures must take place very quickly in order to improve patient safety and satisfaction. However, rapid changes also require careful planning and systematic implementation to be successful. In December 2006, staff within the endoscopy department at Emmanuel St. Joseph's Hospital undertook a project to rapidly increase the number of appointments available for patients needing colonoscopies and other similar procedures.
Lean is essentially taking the waste out of processes as interpreted by the customer, from the customer's point of view. In December, late December, we were given the charge very simply to increase the capacity of the endo unit by 30% by February. That's the first time we've done a quick lean project like that at ISJ, although we've done them in some other organizations. Perception at the time was that the endo lab was at capacity, even over capacity, and that they would have to start taking some endo procedures out to Waseca and other sites because they were at capacity.
Value is defined by the patient.
I think the value to the patients of this project is that they can continue to have their endo procedures done in Mankato. We should be able to accommodate an increase in the number of providers and workload for the foreseeable future with the endo unit that we now have.
Timeline for change, 2 months.
What we hope to accomplish with this project was to add to the actual capacity of the endo lab, and more so the perceived capacity of the endo lab, because their perception was that they were very, very busy at the time and had no spare capacity. We wanted to decrease the chaos felt by the staff if they were doing what we call multitasking at the time, and that's always a bad thing because multitasking leads to errors. And so we wanted to kind of calm their day down as part of this project. We wanted to utilize the entire day rather than just a few hours on Monday and Friday morning. And we also wanted to better utilize the recovery room.
Time to get busy. Key changes.
One of the biggest things we wanted to do was create slots. They didn't have any slots created, so they were putting 5 patients in an hour, and there were hours with no patients. They had 2 rooms to do colonoscopies at the time. What we wanted to do is create a 3rd room to increase their capacity that way. And we also wanted to maximize their slots at 3 an hour or 2 an hour if you didn't have the 3rd room. And we wanted to utilize those slots throughout the day regularly. We also wanted to create a lead nurse who was going to coordinate activities in that unit on an hour-to-hour basis rather than have it going every which way. It's like the right hand didn't know what the left hand was doing some of the time. Another thing that we did was we organized the unit by using a whiteboard, and the whiteboard has their schedule for the day. A physician coming into the endo lab could look at the whiteboard and immediately see what slots were open, who was doing what at any given time. We had a lot of cancellations and postponements at that time, and so we instituted calls the afternoon before to clarify with the patient what was expected of them and to ensure that they were indeed planning on coming the next day. What we did to overcome the challenges was, first of all, we had employees, a lot of employees of the endo unit on our lean team. They would report back and get input from the rest of the employees. This was employee driven. This was not driven by supervisors. In fact, the endo supervisor was not a member of the team. We had 2 of their physicians who were members of the team, and they passed along the information to the other physicians both at ISJ Marsh Street and the Mankato Clinic. We increased the capacity of the endo unit by 30.4%. That's the actual capacity, but more importantly, we drastically increased their perceived capacity. They didn't feel that they were at their max anymore with the slots. The day was smoothed out. They were able to, they were just as busy at noon as they were at 7 o'clock in the morning. No shows and cancellations went from 3.2% to 2.1%. That is something that they're continually working on to this day. Cases from January '07 to September '07 are up about 10%. At the same time, the unused capacity, which is the number of available rooms or slots, actually has increased by 24%.